Daniel, thank you very much for being in the Planet Health podcast, and congratulations for your speech and your talk in the conference today, sponsored by Boehringer. And thank you for being in the Mobile World Congress. 4 years from now, you're an expert in data, no, in general, in genomics data also. Can you explain us a little bit um, what is which are the huge possibilities with these open data platforms and so on?
Thank you, Jody. It's a pleasure to be here. So my work is all about interoperability, making it possible to access and to analyze data from very different sources, very different nature, very different formats, and making it operable, making it work together, and so you can have the whole picture of health, going all the way from macro systems, right, like regions, nations, countries, all the way to the level of the gene when you have data to do so. The access to this data is going to revolutionize. It's already revolutionizing the way we innovate in healthcare. It has revolutionized during the pandemic how we measure the impacts of a virus on the population at many different levels. But now we are opening lots of gates and new paths into drug development using genomic methods like Mendelian randomization to look at what drug targets could be investigated to treat a rare disease, for instance. And this is going to be very exciting, and it's going to happen very, very quickly.
Thank you very much. This at the research level, from an innovation point of view, for entrepreneurs, for the transference of technology, it's always difficult. No, people sometimes don't share the clinical data in these open ways. How we can accelerate even that more? No, to really that the data is used by entrepreneurs, that the patients are engaged in delivering the data in a better way, and the clinicians are not afraid of sharing that data. No.
Yeah. So I think interestingly, this is more than a scientific or technical problem, is a socio-technical construct, I think, right? Yeah. And there are barriers there that have to do a lot with people, with how we have been working until now. Yeah. Convincing a clinician, say a radiologist who has basically been trained to sit down in front of a screen to look for a pneumonia, that now can be done by a computer, and all you have to do is validate that, or maybe use your time for something more useful, is going to be difficult, basically because there are many barriers in between, including regulatory, ethical, and many others, right? So I think it's just a matter of, learning from areas in medicine where this has happened before, and I would, look at what happened with medicines. Medicines at some point were also new. Medicines didn't exist 150 years ago, right? And people found a way to kind of create a framework for the evaluation of medicines and for the approval of medicines. I think we can learn a lot from that and say what are the barriers that are kind of slowing down or hampering the approval and the uptake of these innovations. One of the barriers that I think is there and is going to be hard is not only regulation but also market access, pricing, and all that. And that is in the technological sector, I think, a harder one because it's harder to tease out what's the value or the effort behind a certain technology. I think with medicines that's easier because they've been around for a while, it's transparent, it's easy to know how many trials have been done, how much did those cost. So you can clearly figure out that if a drug costed already in the preclinical area, clinical phase, 150 million, clearly you cannot sell that for 10p, right? Yeah. I think with technology that's a little bit harder, and payers are always keen to cut costs where they can.
Yeah. Oh, absolutely. Regulation at European scale, with the MDR could be initial, as you proposed in the conference, solution. No, obviously with that security, directors of innovation of hospitals could really launch themselves, to the swimming pool. Say, I can't buy that because it's MDR regulated. Yeah. And that could be an initial traction. Still, there could be not this scale-up necessity for the startups, but that could be initial traction slowly. Yeah. Because right now, all these directors of innovations or director of IT or medical directors are doing it under the umbrella of a study that protects them. Yeah. But still, they are not sure because without the MDR regulation and so on. So in that sense, just final question. We're in the Planet Health podcast. Yeah. All this data that is accessible now from pollution, from climate change things. Yeah. How do you see How do you see the increasing the rate of collaboration between administration, researchers, terminals? Because that could be fantastic, no?
Yeah, I think I'm very passionate of the idea of Planet Health and also the One Health idea, right? That a condition that's, because of whatever determinants is happening to birds can spill over to humans and then cause a massive problem. We've been there too recently, I would say. So we clearly have to pay attention to that, and we have to bear in mind that it is a must that we get this right, and this is going to be an interdisciplinary challenge. Yeah. This is not something that epidemiologists can do on their own. No. This is not something that engineers can do on their own. This is a problem that needs all the stakeholders together around the table, sorting this out, right? I think the opportunities are there. I think the data are there. Many agencies around the world are collecting data on all these inputs. We just need to sit down together and say, how do those data relate to each other, and how do we create actionable evidence from that data?
Thank you, Daniel. Congratulations for your work. We must say a personal anecdote. Daniel and myself, we studied in the same university. I think I was 2 courses above him in Hospital São Paulo, no? And it's a pleasure to see him in this massive responsibility, no? In the Oxford University, no? It's a
yes, yeah.
So congratulations, Daniel, and keep pushing for the sharing of the data.
Yeah, likewise, George. It's been wonderful seeing you thriving in this field.
Thank you.